Welcome back. In this video, I'll teach you everything that you need to know about ventricular tachycardia. It's a very common and important topic. It occurs when the ventricles contract very rapidly and in quick succession. This usually gives a heartbeat of more than 100 beats per minute. And because the ventricles contract very quickly, they don't allow enough time for blood to fill the ventricles and then go into the body. So the ventricles essentially contract with very little blood going into the body. And it's also important to know that the cardiac muscles themselves are supplied with blood in the diastolic phase. So when the ventricles contract very rapidly, you will have very short diastolic phases, so very little time for blood to reach the heart muscles. And this can quickly be exacerbated by ventricular fibrillation. So early recognition is very important. In the ECG, you will see a heart rate of more than 100 beats per minute, and you will see that there is no P wave anywhere. As we know, P waves occur when the atria contracts, but the P wave is overshadowed or masked by the QRS complexes, which are very wide. Keep in mind that all the QRS complexes are essentially identical. The most important causes include three very specific causes, and these are congenital heart conditions, potassium level changes, especially in acute setting, and long QT syndromes. These causes are very important to know, so you must memorize them. The patient will be complaining of one of two main symptoms, and these are fainting or loss of consciousness, and this occurs due to inefficiency of the heart in pumping blood. Because like we said, when the ventricle contracts very quickly, it does not allow very much blood to go into the ventricles and then into the body. And this in turn causes less and less blood going into the brain and causes the fainting and loss of consciousness symptoms. And the other symptom is, of course, sudden cardiac death. So you see why it's very important to recognize early and treat as quickly as possible. The most important and quick to know treatment is defibrillation. As defibrillation essentially restarts the heart and allows the normal processes of the heart to continue. So whenever you see ventricular tachycardia, think of defibrillation. Our ECG course contains all the changes that can occur in an ECG, and it helps you become an ECG expert, so that you can recognize any ECG that you might come across. The course contains everything that might affect an ECG, all the symptoms, the causes, and of course the treatments. It also has plenty of quizzes to test your knowledge and make sure that you cement these informations and be able to answer any question about an ECG. You can access the course using the link in the description or in the pinned comment.